Currently, we manage 17 communities. I oversee all 17 of those management contracts, but the other 2 nurses who work with me have specific communities that they are the primary source for. It has been the ability to remotely do some auditing of electronic records in preparation for site visits so that our site visits are more productive as far as spending time looking at direct care rather than looking at documentation. One of my goals when I took this position, because I started as just one of the members of the health services team and was promoted to this position, so one of my goals has been for the health services team to be more of a support to the communities. As nurses, we want to spend time actually looking at resident care, at the environment, at the activities, at the things that matter to our residents and how our site teams are managing those processes. But part of what we have to do with QA is also look at documentation, because that is a huge part of quality assurance. So like for instance, if we have a community that is having concerns about resident falls and incidents, we can look ahead at the incident reports and see how the documentation is. Then we can actually spend the time looking at the resident and the interventions that they're putting into place, whether those interventions are actually happening or not, rather than spending that time at the community looking at that documentation and then trying to look at the actual resident care. I really want my nurses to focus on the clinical aspect, because there is no one else to focus on the clinical aspect. We have other people who can look at the financial aspect and the administration and the management, but that true clinical, only the nurses can truly do that. So you're looking at the trends that are about quality. You're looking at your skin conditions. You're looking at your falls and incidents. You're looking at weight loss. And Answers allows you to really track those and trend those and be able to see data-wise whether it's something you really need to look at. Just because you have a trend doesn't necessarily mean you have a problem, but it means it's something you need to look at. And the example that I always tell communities, because sometimes they feel like they're being a little bit cyber-stalked, you may have a real trend of skin conditions, but if that's your specialty, if you are bringing in skin conditions that other people won't take care of, then that could be a good thing. But if that's not what you're doing and you have that trend, then it can be something that we need to address. So trends are important to determine whether maybe that's going to be your niche market. It's something that you just kind of started getting good at and people realize you're good at it. Or it could be something where you have a problem and we need to look at addressing that. The communities that are using enterprise analytics, I love it. I think that it gives you that ability to track those trends, and then you can do that again remotely from afar, and then you have the ability to go do a site visit and determine, is this a positive trend or is this a negative trend? The marketing people love that. If we have a community that, for instance, specializes in wound care, that also allows us to show the improvement that the community has in specific cases. So that's really important for our marketing people as well. When a director of nursing calls us with a problem, you can't look at a paper chart that the director of nursing is telling you there's issues with. Not that you don't trust what the director of nursing is telling you from a paper chart. To be able to actually look at it at the same time that the director of nursing is looking at it and advise them and consult with them is really quite valuable to us. If you have a concern, again, with resident falls, the alerts and messaging allows us to notify all the way up to the executive director if they want to monitor that for a specific period of time. That's huge, because I've been in management in long-term care. I started in the early 80s, and your day gets very, very busy. And even though you say, I'm going to go to that nurse's station and look at the documentation on falls and incidents, all of a sudden it's 6 o'clock and you haven't been able to do that. So to be able to just pull that up on your computer, or better yet, to have your computer pull something up and show it to you automatically, is very valuable in efficiency.